respiratory. Hi, Mr. Scott. My name is Amy, and I'm a respiratory care student, and today I am here to check on your Venturi mask. And so, as you can see here, the Venturi mask is covered up. So you don't want to ever cover up your Venturi mask because you want to be able to get that flow. So when you cover that, they're not getting the proper flow. All right. So I see the patient is on this Venturi mask, so I'm going to check to make sure everything is open like it is, and it is at the proper setting. And before that, I'm going to make sure I do have the correct patient before I do anything else with them. I'm going to check their name and date of birth and everything. And I'm going to assess their vital signs and do all the assessments of the patient. And so the doctor today actually described that you are ready to go off of the Venturi mask, but they still want to keep you on oxygen, but they want to lower your dose to what is lower than what the mask can go. And so we're going to take off the mask. So I'm going to remove the mask from you, and I'm going to shut this off. And then I will remove this. And then I'll place this in the proper bagging, just that way it keeps us in here just in case we need to go back to a fixed FiO2. So the next one that I'm going to do, and the doctor said that you're having some troubles with having the mask on. So the device that I'm going to choose for you today is a nasal cannula, okay? So that's just going to go around your ears there. Alright, so I'm going to take it out of the bag here. The doctor just wanted you kind of at a low flow, so that way it just kind of regulates your O2 and keeps you at a good rate for you. So with this, you're going to have to make sure you leave it around your ears, okay? And this here, you always want to keep this in your nose. These are the prongs. These will stay in your nose, okay? So I'm going to show you. You're going to put it in like this, and then you're going to have these go around your ear, okay? So I'm just going to go like this, so when they have it on, they're going to go around their head there, and they're going to have it in their nose. Make sure it's placed directly in there, and then it's tightened up, and it's not rubbing or too tight around their head, so it's not going to hurt them. But when I attach a nasal cannula, so I'm going to put it up here, and then I'm going to set it at the flow, and they're only wanting 2 liters, so that's where I'm going to keep it at. And so to make sure I have a good flow, I can still feel it on my fingers. It's really low flow, but you can also tell. So by obstructing the tubing, so you can hear it, slightly hear that it's obstructed and there's not very much flow coming from the tubing. So when you unblock it, you get the flow. So if you have any troubles with this, you feel like it is not working for you, I can change it to something else to help you, okay? But for now, we're going to leave this on you, a simple nasal cannula at 2 liters per minute, okay? And I will come back and check you. So when I am done placing it on them, I'm going to give them a little bit on the nasal cannula, and I'm going to reassess them to make sure their vital signs are still okay and they're not dropping too low. Like if the SpO2 drops lower than normal, then I'm going to reassess them and up the flow if I need to. All right, is there anything else I can do for you today? All right, so I'm just going to make sure they're comfortable and they're ready to go, and I'm going to wash my hands before I leave their room, and that's it.